Dr. Olawaiye, it was so great to see you present the survival data for ROSELLA.
Thank you.
Really exciting, actually, to have this option for patients. I've already talked to patients about it and already excited to use it. What are your key takeaways from your presentation today?
Well, first of all, like I said on stage, it was a presentation of celebration.
For sure, yeah.
It was a celebration rather than presentation because surprisingly, we got FDA approval 4 months before the scheduled time for approval. So that's really exciting. The biggest takeaway from this regimen is the fact that its safety profile is very favorable. Because that's one thing we have to deal with when we treat patients, that it's really, you're trying to help them when you subject them to these toxicities, some of which are very difficult to manage.
Oh, yeah.
So I really like, for a regimen that is as effective as this one is, to be coupled with a favorable safety profile. That is great to see.
Yes, I agree. Yeah, definitely in a platinum-resistant patient who has pre-existing toxicity, is fatigued from prior therapies, having a regimen that's not going to add too much toxicity is great. And also doesn't require a biomarker. So, you can prescribe, start the treatment without having to worry about getting tumor or getting testing done. So that's great too. How do you envision using this regimen in practice?
Ease of use is going to be something that makes the regimen popular. As you said quite rightly, it doesn't require biomarker selection. You can see a patient today and just write the prescription. Once you cancel the patient, which we all do, I think that precision is what all of us seek in cancer therapy. But when a treatment is biomarker select, we often have a perception that the effectiveness of that regimen is likely to be higher. But here we have one that is not biomarker select, but that is also very effective. So this is, in my perception, a regimen that is going to be very popular with prescribing physicians and cancer care providers.
Yes, yeah. And from your ASCO presentation, I loved the part about effusions. So paracentesis and potentially thoracentesis, having a regimen that can limit fluid collections is important for patients too. So anyway, looking forward to hearing more about this on the GOG podcast, the combination of nab-paclitaxel with relacorilant. So thanks so much for your work on this. These patients are going to really appreciate this data.
Thank you, Dr. Chase.
Yeah.